Hi guys, now we're going to talk about sterile suctioning for a trach. So this patient here has a trach but doesn't have a vent, so we don't have the inline apparatus. So the things we're going to need for this is we're going to need our sterile suction kit, right, that has everything in it. And then this is our normal saline that we're going to use to help wash it down and suck it down. We want our suction, and then our suction machine is right here. Now, when you touch this, that hand becomes clean and no longer sterile. So you have to kind of choose which hand's going to do what. When you're very first beginning at this, make sure that you have a partner in the room with you so that they can help you if you forget to turn on your machine or any of that kind of stuff. So I've got everything kind of close by. I'm going to go ahead and open my kit very carefully because it is sterile. All right. And you can see that I have this little paper box here. So I'm going to kind of grab this carefully. And I want to make sure that that inside stays sterile. So I'm going to kind of finagle it like so. And then I'm going to take my saline here and pour it in. So it just fills the box just a little bit. Okay. And then I've got my suction catheter here, which these seem to be upside down. And then this kit, is there 2 gloves in here? Oh, yep, there's 2. Okay. So I'm going to put on my sterile gloves, making sure not to touch anything. Okay, so my hands are sterile. I can touch anything in here, so I'm going to go ahead and touch my catheter here and pull it out. And you can see that it's got this little area. That's where we're going to hold our thumb to create that suction, and that pulsing suction really helps get those secretions out. So I'm going to use this as my sterile hand, and this is going to be my clean hand. So very carefully, I'm now taking this, grabbing my suction, and connecting it, making sure not to touch anything. Okay, I would have my suction turned on. I could use my now clean hand to turn it on. I don't want to, it's very, very loud, so we'll make sound effects for you. All right, so my patient is coughing and needs some suctioning, so I'm going to go ahead and I'm going to suction up some water to get my tube kind of lubed up. Let's go. Great suction, great sound effects. You know, should have been Steven Spielberg. All right, and then we're going to go down in the trachea, very careful not to touch anything. We're going to go down either until we've hit the carina or until our patient coughs, and then I'm going to pulse my thumb, and it's suck, 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 suck. And I get some out, and I want to be real careful about that tip. And then I'm going to let them kind of catch their breath. While they kind of catch their breath, I'm going to suction some more water because those secretions are really nice and thick in there. And then we're going to wait, and we're going to go back down again. Okay? Wait till they kind of cough or until I hit some resistance, and then I'm going to suction. Sometimes I might do a twisting action to get it out. And then see, and usually you'll see some good secretions in there that you've gotten out from somebody. You're going to clear your tube, and then 3 times is as most as we're going to allow you to do. Go down there because you just don't want to take away someone's air that much. Okay, going to let them kind of catch their breath a little bit. Once they're kind of back to being okay, go down one more time. Try and get all those secretions. Again, pulsing that thumb, getting that kind of twisting sometimes to get the sides of it, and get it all the way out. And then we let them kind of catch their breath, kind of suction and clean out your tubing. This all gets thrown away. Your suction tubing will get put back and ready to go for the next time. And your patient, make sure that they're safe and that they're comfortable and that they're doing okay with their breathing.